All right, good afternoon, everybody. Thank you so much for joining us for this next edition in the webinar series. Today we have Elyse Monroy from Cartwright Government Affairs, who will be discussing the advocacy toolkit that she was charged with building from the Nevada Public Health Association. So their advocacy and policy committee head, John Packham, has been graciously allowed us to collaborate with her on this. So we're super excited. However, we're going to go over some housekeeping very quickly before we get rolling. So this webinar is being recorded. I'm doing my best to make sure that the recordings will be available on partner websites. I'm having some technical issues right now, but they should be up soon. However, I've been able to get all of the webinar slides posted on nvbh.org. That is the website that serves all 5 of the state's regional behavioral health policy boards. And also, if she sends them to me, I will try to pop these slides into the chat too before we wrap up today. You should be automatically muted, but please go ahead and try to stay on mute until you're called upon. I do reserve the right to mute anyone who accidentally unmutes themselves while the presentation is rolling. I'm not trying to be mean or rude or infringe on anyone's free speech. It's just a matter of making sure that we're all able to hear and participate. If you haven't done so already, please enter your name, title, and agency in the chat. So we'll probably hold time for questions until the end of the presentation. If you aren't comfortable speaking, by all means, use the Q&A box. There should be a button either on the top or the bottom of your screen if you want to go ahead and use that. If it's not there, you can click the 3 dots that say more, and the Q&A will probably be there. However, we will have time for Q&A at the end, at which time go ahead and use the raise hand function. And you can find that when you go to the reactions. It's usually a big bar there. This particular webinar and all others in this series are brought to you as a collaborative project from the 5 regional behavioral health policy boards and our partners on this, the Nevada Public Health Association's Advocacy and Policy Committee, as well as the Behavioral Health Association of Nevada. The purpose of this webinar is to help our participants prepare for the impending legislative session. We know that there's particularly a lot of confusion as to what is advocacy and what is lobbying. And so just having a clearer picture of where those lines are and what each term means can really help us a lot, regardless of what your role might be. We're doing our best to make sure that we include speakers who are true subject matter experts in this series, who aren't gaining financially or politically by participating. We do have a bunch that I just got scheduled. So other than today, on Thursday at noon, we will actually have a panel with past legislators discussing how to best engage with legislators. How do you schedule meetings with them? What are the do's and don'ts? What are the etiquette? So far, we do have former Senator Julia Ratty, as well as former Assemblywoman Amber Joyner. There's a couple others that I haven't quite confirmed yet, but we will have at least them on the panel. The following day, this coming Friday at noon, Elyse will be back to present on reading, understanding, and using state budgets for advocacy. This is incredibly important information. Next week, I realize that this is after the start of session. On Thursday, we will have an update on the current efforts to improve Nevada's behavioral health workforce. We will hear from leaders at Be Here NV, as well as the Children's Advocacy Alliance. Thursday the 13th, we will have Dr. Terry Kearns from the AG's office present an overview of the Surge annual report. And followed by the next Monday at noon, Youth Behavioral Health in Nevada, State Level Suicide Prevention, and that will be from Emma White. She's an amazing speaker. She actually speaks professionally as well and is also an author and an advocate for youth mental health and suicide prevention. So super excited about that. And last but not least, for those of you who have been reading the news at all and heard about Nevada's agreement with the Department of Justice on youth behavioral health, we will have Ann Jensen from Nevada Medicaid presenting an overview of what that agreement is and is not and what it means on Valentine's Day, Friday the 14th. So super exciting stuff coming up. Other topics that we're still working on scheduling, more information about the crisis response system. We'll also have a lot more on youth behavioral health. I'm trying to get some more behavioral health workforce development speakers going, and we're also going to try to do a panel with all of the regional behavioral health policy boards and or their coordinators, and just kind of hear about the different bills and hear the policy perspectives. So a little bit about the policy boards. There are currently 5 boards across Nevada that are outlined here in this graphic. Each board consists of 7 to 13 volunteer members. So none of our board members are getting paid for the really important work that they do. But each board member is a representative of not only the region that they serve, because priority is given to persons who live and work within the region itself, but also of their professions. So we have law enforcement, criminal justice system, providers, public health, etc. So we've got a really broad range within those 7 of 13 members. Because of their perspectives, we're able to advise state level agencies and commissions. And then each legislative session, each board does get 1 BDR, which is what we'll be talking about when we get that panel rolling. You can see the different breakouts here. So we've got the Washoe board, which is just Washoe. I am the coordinator for the Rural Regional Behavioral Health Policy Board, which is that big section in blue. My counterpart, Sherilyn, is for the yellow part, the Northern Board, which is our Western Rurals. And then we have Mark with the Southern Behavioral Health Region, which is all of those frontier counties across the south and central part of the state, followed, of course, by Clark, which includes not only Clark County, but the southern tip of Nye County to include Pahrump. Each of the coordinators, so my counterparts and I are the unofficial staff of these boards, and we work to align our work with the priorities of our boards, with the priorities and needs of our communities, and then also what funding that we're able to find to keep us employed. We really work to advocate for the communities served by state agencies and let the state agencies know, hey, this is working, this is not, etc. And we connect local and state organizations and communities to make sure that we're reducing any sort of duplication. Here is the contact information for my counterparts and I. The Clark RBHC position is currently vacant. And again, this is a collaborative project. So I'm going to go ahead and stop sharing and allow Elyse to pop her presentation up. Miss Elyse, the floor is yours.
Well, thanks. Let me do the screen shuffle here. Okay. Hello, everybody. As Val was so kind to give me such a nice introduction, my name is Elyse Monroy-Marsala. I'm with Cartwright NV Government Affairs. We were formerly Bells and Case Government Affairs. Same great work, same great clients, new name. So I'm really happy to be here today. And Cartwright NV Government Affairs represents the Nevada Public Health Association, and we have been working with them this interim to do and prepare public health advocates for and subject matter experts for their engagement in the legislative session. And we're really excited to, I'm excited to get to present this information to you, a group that are interested in behavioral health advocacy. So I'm kind of managing 2 screens here with my notes. Okay. So my goal for today is to hopefully increase the understanding of the nuance between advocacy, education, and lobbying. Some of our state's best public health and behavioral health subject matter experts work within agencies that I believe they believe that they are barred from lobbying, but there's a lot of nuance between education, advocacy, and lobbying. So making sure folks understand the difference between the two is really my goal today. And then we'll talk about the process at a high level, and then some tips and tricks for navigating the session. Okay, so first let's talk about advocacy, what it is and why it matters. So I think it's helpful to first define what advocacy is. And I would encourage you, just kind of as we're looking at this slide, it's got a lot of text on it, but think through what advocacy means to you. So how do you advocate in your life, whether it's for your clients or your patients or your friends or your family? What does advocacy that you engage in every day look like? So I think that advocacy looks like helping people navigate their insurance or their healthcare system or a social service, or advocacy can be providing people with information to help, like to help inform the decisions that they are making about their healthcare, about their life. But advocacy, in my mind, is really engaging, helping, and supporting with the goal of changing somebody's outcome. So legislative advocacy, I think, is really similar. So legislative advocacy would be showing up and engaging with the rule-making legislative process. So showing up and engaging with legislators and lawmakers to give them information about about systems you may work in, systems that you may live in, and or information about science or best practice, with the goal of that educator or that legislator having more information about the processes that they are taking votes on, right? So I see a lot of crossover between the advocacy that so many of you as behavioral health professionals and providers and folks that are in that system do. I think there's a lot of crossover between advocacy and the advocacy at the legislature and the advocacy we do for each other and community. Okay, so why else does advocacy matter? In Nevada, advocacy matters because we have a citizen legislature. Not only is a citizen legislature, we have a part-time legislature. So this means that all of our legislators all have other jobs outside of their job as legislator. And they also are being expected as a citizen legislature to weigh in on issues like the broad spectrum of issues, from like land use planning and water rights all the way to mental and behavioral health. So ensuring that legislators have all the information they need to make informed decisions about how they vote and how they engage in policy discussions is important, and that's where advocacy comes in. So if you're following me up to this point, you might be saying, I don't know, Elyse, that sounds like I've seen Thank You for Smoking, and I've watched Mr. Smith Goes to Washington. That sounds a lot like lobbying. And you would not be totally wrong to think that. There is a lot of nuance between lobbying and advocacy and education. So I think it's really important, before we talk about how to navigate the legislature, that everyone here understands the difference between the two, so you can feel comfortable and, most importantly, empowered in your ability to engage. Okay, so what's the difference? So education, so engaging with the system and providing lawmakers with education, it's like neutral, fact-based information sharing. So this is data about a disease morbidity in our community. This is the fact of what is happening. This is the fact of the evidence-based practice or the evidence-based policy that you as a legislator can weigh in on, but this is just the fact of what is happening. Education builds upon that by saying, these are the facts. This is the disease burden for, let's say, unintentional drug overdose. This is the disease burden. This is why this is a problem, right? In our community, this is why this is negatively impacting people's lives. And then these are the things that you, legislator, can do to make a change. And this is why you should do those things. So education, this is the problem. Advocacy, this is the problem and why you should care and what you can do about it. And then lobbying is a formal, direct effort to influence a very specific action by a legislator. So, legislator, vote for SB 500 that will increase funding for or change the policy for, prevention or harm reduction. So that's the difference between the three. Fact-based, neutral information sharing. Like, not even why you should care. This is just what the problem is. This is just how the system works. Advocacy. This is the problem, right? This is why you should care and what you could do about it. And then advocacy would be, dear legislator, sir or madam, can you please do X, Y, and Z? Okay, so what's a couple of examples? I think it's helpful to walk through examples. So legislative education would be, and I used to work in the overdose prevention space, so I'm really comfortable with kind of thinking about our our overdose space. So I'm going to use this as an example. But educating would be providing a legislator with overdose data or information about a systemic or individual risk factor that can contribute to increased instances or risk of overdose. Education. This is the data. These are what the risks are. That's it. Advocacy would be taking that information about the data, explaining why that's a problem, why the legislator should think it's a problem, and then encouraging them to engage in legislative policymaking that would change that, that would address that issue. This is the data. This is why you should care. So this would be providing a legislator with information about how increasing funding for prevention and or harm reduction strategies can increase risks of overdose instances. And then lobbying would be engaging directly with the legislator to vote a specific way. So like legislator, vote yes, or vote yes on SB 500 that increases funding for harm reduction services. So that is a bit of the difference. And if we have time, there's a lot of question and I think concern and nervousness around the nuance between these three spaces. I'm happy to talk in questions if there's still during the question period, if there's still questions in this space. In the toolkit that we've created with NPHA, there's actually a whole FAQ section on what does advocacy and engaging in advocacy look like if you are part of a 501c3 organization or if you are a subject matter expert working within a public system. So appreciate that this is a lot more nuanced and a lot more gray than probably I've broken it down. But I think it's really important for individual subject matter experts like all of you on this call to understand that there is nuance and space between advocating and lobbying. And I believe that we all, as subject matter experts and people impacted by these systems and by these laws, have a responsibility to advocate. Okay, so I think it's important to acknowledge that education, advocacy, and lobbying are like three parts of what is going to drive us to meaningful public health or behavioral health system change. And that's why coalitions are so important, because it's important to have folks driving policy change forward that can bring the neutral fact-based education to the forefront, then the folks who can build and do the advocacy, and then folks who are in a position to go and lobby. But as we're here today, I don't want you to get too mired in what is lobbying and can I lobby, and if I'm in the building, am I lobbying? Like, no, first of all, but I want you to take the information in that I have today and think about your role as an advocate. How can you take the information that you have about disease burden or overdose or addiction or access to medication, and how can you encourage legislators to engage meaningfully in these policy areas?
Hey, Elyse,
Okay.
before you move on, can you go back to the other slide? So something that I wanted to touch upon here, meaningful public health change. So public health does not mean shots and masks. Public health means strategies that address health on a population or community level. So that includes behavioral health. So just think about it in that term. So public health, like behavioral health programming, that's public health. Anything that's public policy and affects health, that's effectively public health. Thank you. Sorry about that.
No problem. Thank you for that nuance. Okay, so now let's talk a little bit about the Nevada legislature. So before we start, I would kind of like to assess kind of the level of knowledge and understanding that we have on the call today. So if you could put in the chat on a scale of 0 to 5, your familiarity with the Nevada legislative process or with lawmaking. So 0 would be like, this is the first time you're hearing about it today. A 1 or a 2 would be like you've listened to I'm Just a Bill, or like me, you binge watched West Wing too many times than you will say publicly. 3 or 4 would be you've testified in a committee, and 5 would be you've championed legislation before. Let's see. Okay, lots of 1s. Hopefully those people are also folks that watch West Wing. If you haven't watched West Wing, you should. 4s and 5s, excellent. Great. So what I'm seeing here is within this group of folks, there is already some significant subject matter expertise of the legislative process. Number five, Dave Marlin, five, but always learning. So look within your community for folks who can help you, right, navigate the legislative process if you still feel like you don't know how to engage after this, after my presentation. Okay, so at a really high level, there we go. At a really high level, the Nevada legislature convenes once, or they convene every other year, so in odd number years for 120 days in Carson City. The session starts the first week of February and runs through the first week of June. The legislature kicks off on Monday, I think it's February 3rd, and will run through January or June 3rd or 2nd or so. The Nevada legislature, like most state legislatures, is a bicameral legislature, which means there is a Senate and an Assembly, so two houses, bicameral. I already mentioned it once before, but Nevada's legislature is a citizen legislature. This means that all the folks that are on this slide right now, they all have other jobs. In this slide, I'm seeing 2 teachers and an eye doctor. They all have other jobs that they do outside of their public service to the state, which is why subject matter advocacy is so important. Another really important thing to know is that our state legislators don't have any partisan staff. So they don't have staffers. Like traditionally, when you think about like going to DC and there's legislative staffers on the Hill, that is not a thing in Nevada. Our legislative process is facilitated by an amazing organization called the Legislative Council Bureau. They are nonpartisan staff that just really keep the legislative trains running on time. But our legislators are truly one-man bands. And I think that's really important to keep in mind as you're beginning to think through what your advocacy strategy looks like. Don't plan or think that like their staff is going to brief them before you talk to them. They are one-man bands. Okay, and then finally, our legislature meets in person in Carson City at the Nevada Legislative Building, but there's a new government center in Las Vegas where you can and should attend hearings in person, and then you can also stream all the hearings. You can participate through Zoom, or you can stream online through YouTube, and I can show you guys how to do that. Okay, so what does the legislature do? What is their charge? So the legislature's charge per the state constitution is to approve a balanced budget for the upcoming 2 years, or the biennium is what we call it. So the governor releases his recommended budget in January. His budget came out 2 weeks ago now. Over the 120-day session, the legislature reviews and makes changes to that budget. So that's like what the Constitution says the legislature has to do. The legislature also considers legislation that is introduced as well. I think it's important to think about the legislature's charge because oftentimes I think advocates think about the budget process happening here and like the policy process happening here. But really, and you hear this often, I think, in advocacy, but like all roads lead back to the budget. And the legislature's charge is to pass a balanced budget. So that means that when the legislature is considering policy, they have to make sure that the state can accommodate the cost for implementation as part of their balanced budget. So that's a little bit of a plug for Friday's webinar. I hope you come back and we'll talk deeper and more in detail about the budget process. But the legislature's charge is to pass a balanced budget for the upcoming 2 years and consider policy that is introduced. Okay. Oh, there it is. There's my plug. Okay. Come on Friday if you can. Okay. So there are much better overviews of the legislative process then I'm going to, that you can find. The Nevada Independent has great ones. The Legislative Council Bureau has great ones. I'm going to talk at a really high level about the process so you as advocates know where to plug in. So first, bills are introduced. They come out in bill draft request form. They're very like high level titles, like this bill impacts education or this bill makes changes to healthcare. Once the bill draft request is out, it will get introduced into the House of Origin. So let's say the Assembly is the house where it's going to start. Once it's introduced, it gets sent to a committee. The committee is where all the action happens. That's where the bill is presented. That is where amendments are going to be put on the bill. The committee is where it's at. And then if a bill gets out of a committee by the deadline, it goes back to the Assembly for a vote. If it gets out of the Assembly or the House of Origin, it goes to the second house, and then it goes back through the process again. So Senate introduction, Senate committee, and then if it gets out of the second committee, it then gets a vote in the Senate. And then if it gets out of the Senate, so both houses of the legislature, then it goes to the governor's office for his consideration to approve or to veto. There are a lot of other very cool little process things that I have gone over. But for the purposes of advocacy, this is how you can plug into this process. Okay, so when you see bill draft requests come out, or you see bill language that's introduced, a great way to start your advocacy is to pick up the phone or drop somebody a line and ask questions about the bill that is being introduced. So if you see a bill that is introduced that's related to substance abuse treatment providers, and you are a substance abuse treatment provider, it's worth it for you to reach out to the bill sponsor and say, hi, I'm a subject matter expert in this area, and I would love to know what you legislator are trying to accomplish with this bill. I think that sometimes we can get mired in politics, but at the end of the day, legislators want their bills to get passed, and they want their bills to be implemented successfully. And importantly, they want their bills to help people. And in order for them to do that, to have the best chance at that, they need help from subject matter experts. And that's where advocacy efforts can come in. So being able to just reach out and ask questions can be a very powerful advocacy tool. The second, I think, way to plug in, and kind of my key tip would be, when you're following a bill, you have to follow a bill through the whole process. So one of the persnickety little details I missed in my overview of the process is sometimes when a bill is referred to a policy committee, it can be determined that that bill has a fiscal impact, or a state agency puts a fiscal impact on that bill, and it will go to a money committee. If you are advocating for a bill in a policy committee and it's referred to a money committee, it is important to follow that bill in the money committee as well. If you're going to advocate for policy change, it's important to advocate for investment as well. And then finally, I would say the legislative session is only the beginning. Regardless of if a bill that you are advocating for lives or dies, passes or fails, the legislative session is only the beginning, because that bill has to be implemented. I can think of 4 bills right now off the top of my head that have been passed in the last 3 years, that where a bill was passed but required regulation, and regulation was never promulgated, it was never done. So if you are going to advocate for a bill, it's important to see through implementation. Also, if your bill fails or doesn't make it all the way through the process, it's important to engage through the interim committees and through like Medicaid open meeting law committees to follow issues, right? Because there could be opportunity for you to bring your issue up again. Okay, we're getting towards the end part here. All right, so these are committees that are important to behavioral health. So Health and Human Services, General Health Policy, Commerce and Labor does policy around health insurance. And then Assembly, Ways and Means, and Senate Finance are the money committees. So those are the committees, and they have subcommittees that review the budget, but they also review fiscal notes, which we'll talk about on Friday if you come. Okay, so what are some tools of the trade? What are some ways that you can, let me see what's next. Okay, so some tools of the trade. What can you use to help your advocacy? So first would be the NPHA Advocacy Toolkit, and then there's some legislative tools that I'm actually going to show you now. So NPHA, we got to work this session with, or this interim with the Nevada Public Health Association to create this advocacy toolkit, which will be your guide to engaging in the legislative session. It's about 10 pages with an FAQ on the nuance between 501c3 and advocacy, legislative advocacy. But I will make sure that Val that Val gets this and shares it with everybody today. So next, let's look really quickly at some legislative resources that you have. Okay, so this is the legislative website, ledge.state.nv.us. This is your go-to place for the Nevada legislature. So first, we're going to look at Nellis, which is, and the best way to learn this website is to click around, but I want to show you how powerful it is. So I'm going to go fast on purpose. So you can look for assembly bills and Senate bills here. I'm going to go back a few sessions to show you just how amazing this website is. So when I worked for Governor Sandoval, on a bill called AB 474. Okay, so every bill that is going to go through the session is going to get like this dashboard. So everything you need to know about this bill is going to be uploaded onto this website. So you can get you can see all the meetings here, all the minutes. You can go back and watch recordings. You can get the votes. You can get the text. You can see amendments. This is just like there's so much information here on these bills, but this is my like government affairs like my best tip for supporting your efforts. Go back as you are engaging in advocacy, go back a couple sessions to see what has happened. Like the thing about behavioral health and public health policy is like we're not fixing any of these problems in one session. We're probably not even going to fix any of these things in 5 sessions. So we have built an amazing legislative record on all of these topics. So go back on bills that you find in your research and look at the exhibits. You can see there's reports here, letters of testimony, support. Like these are just really great resources. Also, the exhibits for bills is a great way to find contact information for people if you're looking to find contact information. So this is a really great resource. Okay, what else did I want to show you here? Okay, let's go back to the home page. I want to show you how to find meetings. So the Nevada legislative process is pretty, I mean, it's open-ish, I would say. It's hard. The best way to be here is to be here, and to follow the process is to be here in person. If you can't be here in person, there's great ways to engage online. So if you are on the home page, you can go to view events, and this is going to give you everything that's happening today and then everything that is upcoming. So today, the Health and Human Services budget hearings are being heard. The budget hearings are happening. So you can see the agenda for the day. During the legislative session, you're going to see like Assembly Committee on Health and Human Services, and then where you can find the hearing, and then also like a list of all of the bills that you might be tracking, which you can also track bills, through Nellis. You can sign in and register and track up to 10 bills for free. When you track a bill, you will get an email alert of that bill being heard. Okay, but one of the cool things is you can watch these hearings live. So this is the HHS hearing happening now. And this is streaming from the legislative website, but I like to watch these hearings on YouTube. I like to watch them on YouTube because it's easier for me to go back and watch them later. The Nevada legislature's website on YouTube is popping during legislative session. So you can subscribe and then, I'm not signed in, but you can subscribe and then get alerts when a hearing is about to start. So there's a lot of information about these resources in the toolkit that you will get, but spend time on the legislative website and on Nellis and to familiarize yourself with these resources. Okay. All right, I'm actually just about to wrap up and hopefully you will have some good time. Oh my gosh, how do I do this? Okay. Oh, sugar. Sorry, guys. I feel like Toy Story when Pig is like doing that. Okay. Okay. So did that. All right. Oh, I didn't show you. I'm sorry. I'm going to show you how to find your legislator. I'm sorry, guys. I'm doing this on one screen. Okay, so this is the best way. The best way to start your advocacy journey is with your individual legislator. So I'm going to put in our office here at at the Cartwright NV Government Affairs, and I can show you. So our legislators are Lisa Krasner and PK O'Neill. So I know that if I have questions about the process or if I want to ask questions about a bill, I can always start with my legislator. So through this website, I can see which committees Lisa Krasner is on. So if a bill that I'm watching is maybe being heard in judiciary, she's going to be a great person for me to reach out to. If a bill that I care about is actually not being heard in judiciary, she can help me get connected to the right folks. And you can also find, this is going to take us back to Nellis, but when you are looking at committees, you can see everybody that's on these committees and you can figure out how you can email committees directly from Nellis. Okay. All right. So from current slide. Haha. Okay. Okay. So how can you engage in the legislative session? Okay. So there are a lot of ways that advocates can engage in a very active way or in, I think, a more passive, quiet way. So first, you can follow bills that are or bills or topics that are of interest to you. You can just review bills. You can then contact legislators or you can contact committees to ask questions about bills. You can submit research reports or evidence. You can submit letters with maybe how a bill or an issue has impacted you personally. When you submit something to to a committee or to a legislator, it becomes part of that that bill dashboard of the exhibits I showed you, but that's the legislative record. And it's so important for people who are experts to engage in the process of building out the legislative record. Because I will tell you that if folks that are doing the work, or if you're part of a nonprofit or whatever, and you're not engaging in advocacy, someone who can engage in lobbying is going to speak on your behalf and on your patient's behalf and your client's behalf. So as people who hold so much information and so much knowledge about our system, it's important for you to engage. So even if that's just like, if you see a bill about, let's say you see a bill about harm reduction or increasing funding for harm reduction, and you have expertise about harm reduction and you found a report, submit that to the committee so they have it as they are weighing in and engaging with the bill. Next, you can engage with committees directly. You can provide public comment. You can provide support testimony, you can provide opposition testimony, or you can provide neutral testimony, which would just be very basic, like this is information, kind of that more education, fact-based information sharing. You can also submit letters directly. You can and should do direct legislator outreach. If you haven't reached out to your legislators yet, just to let them know you're their constituent, you should do that. I actually called my legislator last week just to introduce myself before the legislative session started and talk about things that mattered to me, and she was thrilled to take my call. And then finally, you can write op-eds, which are putting op-eds in places like the Review Journal, the Nevada Independent, or the Current are great ways to get legislators and the public at large to see kind of what is happening at the legislative process around issues you care about. Okay, so I don't know how much I want to talk about this, but so the legislative landscape, essentially, if you followed the last session, it's kind of more of the same. After the election, we didn't see any big swings or shifts in makeup. The Republicans picked up a couple seats, but nothing to take away a Democratic majority. So a little bit more of the same in terms of legislative makeup. However, I anticipate this go around legislative Republicans having a little bit more say than they did last time. But the Democrats still have the majority. Okay, so some behavioral health bills. And this is not an exhaustive list at all. These are just a couple things I wanted to flag for you. The Regional Behavioral Health Board bills, if you're not tracking all of those in Nellis, and we might even be able to put the bill numbers for you to track them. I'm going to make a note to send that with the NPHA toolkit. So you should track those bills. You should track bills related to systems investment or changes. So the governor's budget included a reorganization of Health and Human Services. It's going to take Medicaid out of DHHS. That's a huge change for the state. There's also smaller initiatives to change our system, which is the Fetal Alcohol Spectrum Disorder Health Home. That's going to change how we deliver care for those folks. There's a number of bills about workforce development. The Patient Protection Commission has, I think, 3 bills. And then I would also encourage you to follow bills related to providers, so specifically rates and then how providers are paid. And like I said, I actually forgot to update this slide with bill numbers. So I'm going to provide bill numbers for these things, and I will make sure you all get them so you can engage in the legislative session. And that is the end. That was a very fast overview, but I'm happy to take questions.
All right. So again, if you want to ask a question, feel free to use the raise hand button, which should be on your toolbox. In the meantime, we do have a question from the Q&A box from Stephen Burnett. What role does the Nevada Supreme Court play in the outcome of a bill?
Um, that's a good question. The Nevada Supreme Court does not engage in the legislative process unless there is an issue with a bill. Unless there's a big issue. So what I'm thinking about would be if so in 2003, the legislature did not approve a balanced budget per the Constitution. So the Attorney General filed a motion, essentially sued the legislature, and then the Supreme Court weighed in and said, I think they said you have to raise revenue, but the Supreme Court does not weigh in on the legislative process generally.
Excellent, thank you. Again, if you have any questions, please use the raise hand emoji, or we'll go to the Q&A box. All right, and then Stephen Burnett had a follow-up question. Has Nevada legislation discussed the possibility of Medicaid cuts?
So we'll talk a little bit more about Medicaid in the budget presentation. I really want you guys to come to the budget presentation. But Nevada is looking at a small decrease in the federal funding that comes in for Medicaid. But Medicaid is also looking at increasing some rates. So Medicaid is incredibly complicated. But right now, they aren't looking at like sweeping cuts, but there is going to be a reduction in the federal match that we get, which is a very complex answer. Sorry.
No worries. Thank you. So I have a quick question while everybody else is kind of noodling on their questions right now. You mentioned using op-ed opportunities in various newspapers and other media outlets. How can you make sure that any op-ed that you write is on the side of advocacy or even education and not lobbying? Any hints on that?
Well, again, I would if you kind of think about the nuance between education, advocacy, and lobbying as like this neutral fact-based, I'm just information sharing about disease risk. In advocacy, I'm telling you, I'm building on the information and telling you why you should care and generally what can be done. Lobbying is specifically legislatures support this bill. This is an incredibly complicated topic for 501c3s. And as part of the backup for our toolkit, we have included a slide deck from Stacy Shin, which goes into the nuance of what like lobbying versus grassroots lobbying, which even has completely different rules. But generally, if you're writing an op-ed, try to stick to that neutral fact-based information sharing. And then generally like advocacy, like to advocate in an op-ed, build upon your advocacy by explaining to people why they should care.
Perfect. Thank you. Sorry, I had a minute trying to get my mic turned off. So we do have a couple folks who have popped in specific legislation in the chat. I uploaded SB 68, which is the Rural Regional Behavioral Health Policy Board's bill. And then also Sherilyn Rar-Woods, my counterpart for the Northern Board, has also popped the link to AB 60 in there. Our other counterpart, Mark Funkhauser for the Southern Board, provided the link for AB 31, their bill to affect behavioral health secure transportation. All right, and I see some really great examples there. So, any other
Yeah, that's
questions?
actually a really good, sorry, that's a really good formula for like, that actually looks like from my last presentation from Steve Messenger, a really good formula for like how you can engage in that advocacy and what advocacy looks like without like saying getting into lobbying.
Perfect. Okay, I'm going to go ahead and take a quick snip of that too. All right. Any other questions for Elise before we call it an afternoon on this particular webinar? All right, so Elise did include her slides in the chat. I will also be posting them to nvbh.org. Elise, if there's any way to go ahead and send those to me, I can get those posted on nvbh.org as well with you and John's permission. Thank you, everyone. I'm not seeing any hands raised or any more questions, so I think we're going to call it. Thank you, Elise, for your time, and please,
Excellent.
everyone, register for this week's other webinars. Again, now that
Yeah,
you've been through this advocacy training, you should have some great questions for the legislators on the past legislative panel that we're having on Thursday at the lunch hour, and then Friday, Elise will be back with us to discuss budgets. Have a great week, everyone.